Welcome back to The Wellness Script, your source of truth on all things health and well-being. Today's guest is Lorraine Cooney, a specialist gastroenterology dietitian based in the Blackrock Clinic in Dublin. She runs their gut health clinic and is also the author of 2 incredible books on the subject, Why You Can't Go and Gut Feeling. She'll be sharing practical, evidence-based tips and information on the subject, and I can't wait to talk all things gut health with Lorraine. Here is the episode. Lorraine, you're very welcome to The Wellness Script.
Oh, hi, Lauren. Thank you so much for inviting me. I'm delighted to be on your season 1 of your new podcast.
Yes, thank you so much for coming. And I think this subject is one that people will be very interested in. We're going to be talking about all things IBS. We're at the start of the year. Maybe if somebody has been experiencing gut symptoms, that it's finally time to kind of address them. So I hope that we will kind of touch on lots of those kind of subjects today. And you quite literally wrote the book on this subject with your 2 books. So plenty to talk about there. I think a good place to start might be to talk about how prevalent is IBS and how would you know if you have it?
Okay, well, it's largely misunderstood and it's also very prevalent, more prevalent than people would think.
Okay.
I estimate probably 1 in 10 people likely have IBS. And I think why we're not so sure is that probably about 40% of people don't seek healthcare advice when they have these symptoms. They tend to learn to put up with them or think that that's just the way they are. Mm-hmm. And up to 40% of people attending a gastroenterology clinic, that's your gut health doctor,
yes,
have IBS or IBS-like symptoms. Okay. 10% visiting GPs. So it's really prevalent.
Okay.
And how would you know? This is also quite a vague area because we don't have a diagnostic test.
Okay.
There's no blood test or you can't see it on a scope or a camera if you're investigated. So you have to go by these criteria. They're called Rome 4 criteria, if anybody wants to know. Mm-hmm. But they're like the defining symptoms that people have, which is abdominal pain at least once a week and is ongoing. And then that's related to a change in your bowel habit, the frequency or how it looks, usually also associated with bloating and gas, likely triggered by stress and anxiety. And that's how you fit into that Rome 4. But also, in the meantime, you'd have to outrule celiac disease and ensure there isn't an inflammatory driver in all of this, some blood tests.
Okay, so if somebody... they're listening and they're thinking, okay, some of that applies to me for sure. What is the first step that somebody takes then?
So just go to your doctor.
Okay.
Yeah, because they have to go down through this with you and assess you.
Right.
Dietitians are very good at doing this as well, but
yes,
we don't typically diagnose. It's your doctor that you would need to see first. Just because it may look like IBS, but it may not always be IBS. So that's why you need the blood test for celiac, blood test for inflammatory markers. Yes. They need to ask you about your symptoms, look at your medical history, check that you're not having, blood in your stool, losing weight, waking up at night with pain or having bowel motions, family history of bowel cancer. Not scaremongering here. It just is a process. We call it best practice. That's just what you do.
Yes.
And then it'll help you understand that that's exactly what you have. Because what we have is mimickers to IBS. Okay. So things that look like IBS but are not IBS, such as your inflammatory bowel conditions like Crohn's or colitis.
Yes.
Possibly in subset of people it may be a cancer. Maybe it's things like the random things you might have heard of, a bile acid malabsorption or microscopic colitis. So it just is worthwhile having a medical oversight into what's going on for you. Yeah.
Okay. And then from that point then, if you get the all clear, you don't have celiac disease, you don't have any inflammatory kind of markers, I suppose, that are concerning, then they would come and see somebody like you and you then go through their full, I suppose, their full diet, would it be? Or
absolutely. Very comprehensive assessment because you want to join the dots. And these are very multifactorial type conditions because it doesn't look the same for anybody. No 2 people are the same. So you want to look at the medical history and the diagnosis, medications, what they've tried, maybe medication-wise or supplements that worked or didn't work. Then you profile all the symptoms to get an idea of where they are. And then look at lifestyle factors. So I mentioned stress and anxiety, but it's really important to kind of understand each person and how that impacts them. And it may not even be legit stress or anxiety. You just might be busy. You might never stop or take breaks or relax. That's very relevant. And how you sleep at night is really important.
Okay.
And then, we'll delve into the diet, all the ins and outs of your typical diet and your eating habits. And that really tells me what might be going on. So I've seen so many people now, I can feel very confident in knowing how to maybe apply the advice to each person and personalize it. Yeah.
Okay. And And when you mention the diet and IBS, what I see a lot coming up in real life and speaking to patients in the pharmacy kind of setting, and then also, you know, online, you hear a lot about kind of restriction and like cutting everything out and then building it back up again in terms of their diet. Is restriction or elimination sometimes appropriate or ever appropriate?
Yeah, definitely sometimes appropriate, but
Okay.
not what you would do at first.
Okay.
So at first we have what we call first line interventions. These are the basics.
Yeah.
They're often overlooked, but they are so powerful.
Okay.
But they tend to be the boring things that people think, oh, why would I be doing that?
Yeah.
But actually having regular meals,
Okay.
that's so important.
Yes.
Taking your time eating, sitting down to have a meal, chewing your food well, staying hydrated, not overdoing caffeine, alcohol, chili, for example.
Okay.
They're quite obvious. So you'd know if they're triggering your symptoms, same as maybe high-fat, greasy, creamy foods. And then looking at the fibre element of your diet. So people are scared of fibre. They think fibre is bad.
Okay.
They might have tried to increase fibre and had more symptoms, so I get it. And
Yes.
actually 90% of people would attribute food to worsening symptoms and feel
Okay.
worse after eating. So this is all about the function of your gut isn't working well. That is what IBS is.
Right.
Things aren't moving well. There's too much
Yes.
sensitivity and there's a gut-brain connection. So you kind of feel like the bowel is just on high alert all the time.
Okay.
So you may be reacting to foods. It's complex to understand which foods they are. But bringing it back to basics, soluble fibre foods in particular are very well tolerated by people with IBS.
Okay.
You know, things like oats,
Yes.
maybe some sweet potato, cooked spinach, kiwis, berries,
Okay.
linseeds. Those types of foods are really good. One,
Yes.
because they help with motility
Yes.
and regulating stools, your bowel habits.
Yes.
And probably also communicating with your bugs, to communicate with your brain to say that everything is okay.
Okay.
And then I lose my trail of thought. But yes, so what's really interesting recently, apart from the restriction piece, so we can talk about low FODMAPs if you like.
Yes.
That's a restrictive
Please.
diet. But recently there's been 3 trials on the Mediterranean diet and how that can improve symptoms of IBS.
Okay.
So for anybody who wants to know, the difference is that Mediterranean diet is not restrictive. It's
Okay.
largely a plant-based diet. It's high fibre. It has loads of healthy fats.
Yes.
And has less of the processed foods, less red meat.
Okay.
And that has been shown to be very effective at managing IBS. So it's not about restriction.
Okay.
And I see this in my practice. I definitely first rule is to increase your fibre. And you can do that in a very gentle way, very systematic.
Yes.
And it generally works well for a lot of people.
Okay, and when it comes to there's loads in that Lorraine, thanks so much. There's, I suppose, with fibre, people are scared of it. Is that because when they have tried it in the past, it's because they've gotten a flare up or they feel really bloated, maybe, or
Yeah,
okay,
exactly. And there's all different types of fibre.
Yes.
And we have these fermentable fibres, which comes under that umbrella term of FODMAPs.
Yes.
And so that has been shown to be a trigger for people with IBS. And if you
Okay.
follow a low FODMAP diet, it can help up to 60% of people.
Oh, wow.
Maybe a little bit higher.
Okay,
But if you don't have the basics right, I don't think you get as much out of the FODMAP piece.
okay,
Because you have to have the basics to understand where your baseline is and then
Yes.
how you would react to or respond to restriction and then how you put the foods back in to really
Okay.
understand your triggers.
okay,
So it's more complicated than just finding a sheet online and following it.
yes,
Or,
yes,
everyone says avoid onion, garlic,
Yeah.
wheat and dairy. So you just do it because you think that's the right thing to do. But I don't find that people have intolerances to all of those 4 foods. It's usually one.
Yes.
Maybe a bit of 2. Maybe it's about portion size control.
yes.
That
would include a huge amount of foods as well,
Massively.
Lorraine, in terms of restriction. Like
Yeah.
that's the staple of most people's diets. If you include all of those, of course,
Yeah.
some people might have sensitivity, as you said, to 1 or 2, but to
Yeah.
immediately restrict all of them and not know really, I suppose, if that was the cause or not, Yeah.
Because people I would meet generally have done this already. They've restricted their diet, maybe 10, 15 foods, but their symptoms aren't better.
Yeah.
And they may have stayed on the restriction. So that's a really big mistake because you
Yes.
don't want to do that. Restrictive diets are about restricting for a set period of time.
Okay.
I would say about 2 to 4 weeks maximum.
Okay.
And then you put the foods back in one by one to understand how you're reacting.
Yes.
Now, how you react is really important because with IBS, you have this anticipatory response, which we can kind of say is nocebo. So if you think a food is going to be bad or that you will get bloating or pain from it, you actually can. But it's not because of the food. It's because of this gut-brain axis. So your
Wow.
gut and your brain are intimately connected and what you think and feel can impact how your gut responds.
Yeah.
So I'll give you a nice way to understand that because
Yes.
I see people often telling me that they would eat the same food One day they will react and the other day they won't.
Okay.
So it's not the food.
Yeah.
It's how your gut is. So it's maybe on high alert, maybe you feel as a threat. And maybe because you perceive you will have a response, a negative response, you'll have a negative response.
Wow.
We've shown this repeatedly in trials, blinded trials with, say, gluten and lactose.
Okay.
So you have people who really feel they react to these foods, put them into the trial, say that you're giving them either lactose or gluten, but you're not.
Okay.
It's a bit of
a
a sly move on the research side of things, but actually you will find that they will respond even though they did not get gluten or they did not get lactose. So we know that this is a big part of looking at figuring out your true triggers. Yeah.
When it comes to nutrition nowadays, we're not just trying to avoid deficiencies, we're trying to optimize how we feel day to day. A lot of the people that I speak to are genuinely doing their best. They're eating well, exercising, getting decent sleep, but still feel like they don't quite have the energy, immune resilience, or overall balance that they would like. And that's one of the reasons I've partnered with Sona, Ireland's favourite vitamins, as the sponsor of today's podcast. They're an Irish family-run company with over 40 years' experience, and everything they do is evidence-based, which really matters to me. With over 150 science-backed products, their range covers everything from immune and energy support to omega-3s, digestive health, bone and heart health, as well as pregnancy, fertility and children's vitamins, all manufactured, of course, to the highest manufacturing standards and repeatedly tested for purity and potency. You'll find Sona in local pharmacies, select health stores nationwide, or you can explore the full range at sona.ie. Okay, back to the episode. Wow. Okay. And that's so interesting, because I suppose as well, if people are self-directed restricting their diet, but all by themselves, and they're reading a list online, okay, I won't eat any of these foods. Surely then, as you said, if they're not improving, they could also be worsening like their symptoms and also just how they feel, because they're not actually nourished, isn't it? You're not getting enough of what you need if you're cutting out entire food groups or...
Brilliant point.
Yeah.
I'm really on board with that. Yeah. Nourishment is so important.
Yeah.
So you want to feed your body with nutrients.
Yes.
But you also want to feed your gut bugs, which are these trillions of bacteria that reside in your large intestine.
Yeah.
And their food is our leftover food, and it's usually plant-based foods. It's your grains, your fruits, your vegetables, your nuts, your seeds, your pulses. So we know that people on long-term restrictive diets would have worse balance of microbes.
Okay.
Because the bugs aren't getting enough food to flourish.
Yes.
And then the other bugs can come out to play, the ones that you don't want hanging around, maybe more pathogenic. And there's this imbalance.
Okay.
And I think that can impact then your gut-brain axis, your mood, motility in the gut, this hypersensitivity piece that you want to kind of calm down, not make worse.
Yes.
So there's a place for restriction, absolutely. I'm not dissing that. And we have piles of evidence to support that. It's just how you do it. Do it correctly, get the basics right. And then if you're not right after that, then I would use a restrictive diet.
Okay, but it has to be guided, really. You can't go on a restrictive diet yourself, and expect good results, really.
Well, if we look at people who have done that and interview them afterwards, they will say, it was very difficult to do. Yeah. I didn't know what I was doing. I found it too hard, and I wish I had professional support. Yeah. So we've shown that actually is a thing. Yeah. But I get it.
Yeah.
It sounds simple on paper. You restrict, but then what are you looking for? Do you understand how your gut is actually behaving? Are you feeling better? And if not, don't restrict anymore. It just means that if you're not responding to a restrictive diet, it actually just means it's not that it's not successful. It's just you're barking up the wrong tree.
Yes.
Your body is telling you that that's not what it's looking for. It's looking for something else.
Yeah,
that's worth delving into too.
Yes, absolutely. You're not addressing the root cause, I suppose. So I suppose from a kind of simple perspective, maybe if someone who's, I suppose, mildly gets gut symptoms and would like to address it, are there you mentioned regular meals, are there other simple gut habits that can help our digestion, motility, symptoms? I suppose when you mention regular meals, is that like breakfast, lunch, dinner?
Yeah,
as simple as that? Yeah.
Yeah, it's very consistent.
Yeah.
So your body and your gut bugs, they're very clever, by the way, and they anticipate food as well.
Okay.
It just loves regular meals.
Yes.
You were all on clocks as well. You've got this circadian rhythm. Regular meals feed into that, which impacts how things move through your gut, how enzymes and fluids are secreted, and how things work. Really, it's a lot of complicated processes.
Yeah.
So that regularity
Yes.
is probably the most boring thing, but I just see that working so well.
Okay.
And avoid long gaps between meals.
Okay.
Avoid maybe grazing. And try and take your time to eat. So we live in a very busy world. It's frantic most days, so we tend to gobble down food a lot.
Yes.
Put my hands up, I can do that sometimes too.
Yeah.
But if you do suffer with gut symptoms, if you take your time eating, sit down and try and just give yourself 15 minutes protected time to eat, you can have a huge impact on giving a safe message to your body that everything is good. Because if you're on the go, you're in a nervous state called fight or flight. But what we want to eat is the opposite. You want to be in rest and digest, which is this relaxed state. So if you're gobbling food and also looking at your emails and taking phone calls and paying a bill, you're just in this fight or flight. And that hampers digestion.
Yes.
So if you can take your time to settle, even take some deep breaths, deep belly breathing. I don't know if you've maybe covered that in another podcast, but it's really nice just you take a deep breath, breathing in through your nose, and then you kind of hold for 2 and you breathe out from your mouth. But the exhalation is longer than the inhalation.
Okay.
And it helps you kind of relax. You feel your shoulders relaxing, feel your jaw relaxing. When you do that, your gut is relaxing.
Okay.
And when your gut is relaxed, it can digest better.
Yes.
So for a lot of people, even with the fibre piece, I find if you do the deep belly breathing exercise before meals, then you can it will help you increase fibre. So you have a relaxed body, relaxed gut, you will tolerate food so much better.
Okay, because your body's almost like, okay, we need to go and like run or fight or something like that. There's no time to be like snacking or having a meal kind of thing. So it's not primed to handle food, I suppose.
Yeah, and that's really at the essence of IBS management.
Yeah,
it's like how your gut is, how your brain is, how your nervous system is how then you react to food.
Yes.
Not that all food is triggering.
Yes, absolutely. And you mentioned soluble fibre back there. I just wanted to come back to that because the opposite of that, I suppose, is insoluble fibre. So does that, I suppose, what is that? And is that something that's difficult for people who are experiencing flare-ups?
Yeah, this is kind of hard to answer. It's like a maybe.
Okay.
So things like pure bran would be shown to irritate the gut.
Okay.
But what we get with soluble and insoluble fibre, usually there's a bit of both in a lot of foods.
Okay.
So some foods might be more insoluble.
Sure.
Some foods may be more insoluble. So I would start with soluble because they're gentle, easy to digest, and they feed your bugs. And then you would have a better balance of bugs. And then I would start by having more of the insoluble.
Okay.
But I don't really differentiate that much between them because it's not black and white.
Yes.
And it's each to their own. So establishing this kind of structure of increased fibre gives your body a more resilient gut microbiome, which I then think your gut functions better anyway.
Yes.
And if you can regulate your stools, then I think most people can tolerate a lot of fibres.
Okay.
Yeah, you just don't go from 0 to 100 overnight. You don't want to go and just, throw in loads of fibre one day with a sensitive gut.
Sure.
Don't do that because your gut is sensitive.
Yes.
So it probably will have a negative response to going too hard, too fast. So that's why I kind of take it in a gentle way. Try one fibre food, say every 3 to 5 days.
Okay.
Longer if you're extra sensitive. It's not a race. And then you sort of gradually build and keep reintroducing over time.
Okay. And if you're someone who just has a healthy gut and just wants to introduce more fibre, you see a lot about 30 plants, I suppose. Is that a good rule?
I like that.
Yeah.
And the reason for that is that because if you have more variety of plant-based foods, that's your grains, your fruit, your vegetables, your nuts, your seeds, your pulses, foods from all of those groups, not eliminating one group. And the variety, because all these bugs, there's trillions of them and they all like different foods. So you're kind of feeding them all.
Okay.
And then it has been shown to have a better diversity of gut bugs.
Yes.
Which is a sign of better gut health.
Okay.
So that's the research that's emerging in that field. Yeah. So I think variety is a really great message.
Yes.
Not bucket loads of one food.
Okay.
But lots of different variety of different plant-based foods.
Sure. And maybe moving with the seasons in terms of fruits and vegetables, then you're going to change, the fibres that you're exposing your gut to as well.
Yeah,
and obviously it's more conscious in terms of we're not importing everything. We're kind of trying to eat what's actually in season here in our own country. And I think you mentioned a lot there about kind of the gut brain and how it's bi-directional. The brain is communicating with the gut and vice versa. So I suppose I'd love to kind of delve into that more with you. I know that you had your own gut journey, Lorraine, and how, you know, you tried your best with the typical kind of approaches, but it was really, I think, the gut piece that unlocked more for you. Yeah,
it's kind of like the irony isn't lost that a dietitian would have gut symptoms and not being able to manage them. But I knew I wasn't responding to diet, and I wasn't getting the advice elsewhere to kind of think, well, what is causing this? And nothing was really working. But obviously, like reading the evidence all along, and I had read about something called gut-directed hypnotherapy. So have you heard of that before?
No, so interesting.
This is really interesting, but it actually has been around 40 years. It just isn't very well known. And I think it's because it takes time to implement in practice.
Right.
And it's kind of like a last line thing. But now, because of the emergence of understanding as much as we can, we'll never fully understand IBS, I don't think, but as much as we can, that is a gut-brain miscommunication entity, that you actually want to target this gut-brain axis. And so gut-directed hypnotherapy is a very therapeutic intervention. It's very relaxing. It's really beautiful. And it helps the person become deeply relaxed. And when you're in that state, you've heightened awareness to messaging that you're receiving from your practitioner. You can kind of change your perspective of how you respond. So that is your gut-brain axis. You can just target it. So it can reduce sensitivity in the gut. That's what's been shown to do in the research setting. Change how your brain processes pain signals. So pain is the piece of IBS that is there mostly all the time. So it's very effective. And you need about 6 or 7 sessions with this gut-directed hypnotherapy to actually see an effect, a positive effect in the gut. But once you target the gut-brain axis and bring in the diet piece, more fibre and better eating behaviours, I found that that's a real game changer for a lot of people, especially people who suffered with IBS for a long time, 20, 30, 40 years.
It's hard to probably trust that anything will work, I wonder. Is that kind of part of it?
Imagine, yes, if you have it for 30 years, you'll think that's me, this is it, I just have to live with it. But you have a diminished quality of life. You don't get to do the things that you really want to do. And you're afraid of foods. There's a lot of food fear, food anxiety. You don't want to leave the house. You always have to know where the toilet is. You don't want to get on a plane. You don't want to eat dinner out with your friends. You don't want to go to friends' houses. All these things that people take for granted are normal. That you kind of, reduce yourself to not want to do those things in a form of control. So I have felt that accessing or targeting your gut-brain axis is a real big part of it. Stress, anxiety, past traumas, all impact how your gut functions. And I would never say that I'm treating trauma or anxiety. I'm just treating how the gut responds to signals. But it can be really, really helpful.
Well, you have to treat the whole person, isn't it? Like, we can say that, this I don't know, a particular food type that we're eating is irritating our gut. And I know you mentioned this is probably the last line treatment in terms of hypnotherapy, but I would imagine it would benefit anybody from
I couldn't agree more.
You can only gain from exploring the psychological aspect of why you have kind of gut symptoms. I'm sure there's always a psychological element,
it's really interesting because what I found in the people who I use my program with, I combine diet and hypnotherapy together, called the Diet Hypno program. So you get to learn how your gut actually behaves. So for the first time in your life, you understand why your gut kicks off, how you respond to interventions. And it kind of just, overall, you have less panic, less stress about it. And you don't actually tend to suss that out unless you do the hypnotherapy. It's been a game changer for a lot of people.
They're like, I remember doing college exams and like actually being doubled over, like completely unable to move. I thought it was like my trousers were too tight or something. Maybe that was part of it, but I used to suffer terrible with it in college, and now I just never get it anymore. I think I finally just
fantastic,
stopped being so highly strung or hyper stressed about everything all the time. And it was a huge psychological element to that, which is why I'm so interested in it. And like, even going back as a child, like I suffered with like constipation and things like that, and I was definitely like an anxious child. So I just think there's such And I remember actually the consultant saying like, and are you worried about anything, Laura? And I was like, no, like, but obviously they knew that like, there is such a huge element of that too.
Yeah. And even if you don't feel stressed or anxious, your brain is involved.
Yes.
But
of course.
IBS is, because you can't see it doesn't mean it doesn't exist, and it's not in your head. It'll never all be in your head because you have physical symptoms.
Yes.
They're 100% valid. So even if you don't feel stressed, your brain can still be impacting how your gut behaves. So that's why it's really interesting to delve into that, particularly if you haven't had success with dietary interventions or medications and you're not getting anywhere. But I think you learn how to tolerate food and what foods you can actually tolerate going through the process of diet and hypnotherapy together. The really fascinating thing that I just think is just the most brilliant thing ever is that at the end of the program, most people don't have food intolerances.
Wow.
Yes.
Okay. So there's this huge thing of like testing for it. And I don't know how much of that is valid or not valid. I would imagine you need to go to a reputable clinic to get food intolerance testing done.
Yeah, they're not very valid at all, actually.
Okay.
So I wish we had those tests. Maybe we will in time.
Hopefully.
Because, science is getting so much more advanced in our understanding. But at the moment, it's not.
Okay.
So food intolerance tests are just hocus pocus.
Really?
Yeah, they're only telling you exposure to food. So if you get the test, it tells you what you eat.
Yes.
Then it tells you to avoid all those foods. So yes, maybe you're going to feel better. But it's never done in a structured way of take them out and then reintroduce them.
Okay.
But it's not a legit way to understand what's going on with your IBS and
symptoms.
God,
that's my mind is like blown. It's telling you, obviously, yes, you've been exposed to this. Yes, your body is responding to this type of food.
Yeah.
So try and remove, so then I don't know what that would leave left to eat, which is why people end up so restrictive and scared of food.
Very restricted. And so I think that has more damage on the person ever than food itself. It sounds like it. Because you will increase this food anxiety, food fear. Some people even develop eating disorders.
I can see
or disordered eating. And it also will impact your gut microbiota, which is involved in all of this. So you don't want to starve your microbes. You want to nourish them. And I think it does lead to nutrition deficiencies as well. And then if you stay on that restriction long term, it is harder to bring it in. But if you are in that rush, there's things that can help. Starting even with that deep belly breathing, starting with the consistent meals, starting with taking your time. And if you still struggle, then I would definitely look down the route of gut-directed hypnotherapy.
Okay. And one other thing that comes up for me in the pharmacy setting as well is when people start exercising more and then try and eat more, they often say, I've been eating protein. God, it's like really, or drinking protein, whatever, it's really like affecting my gut. Is there anything I could take? Like whatever. Is that something that you see in practice as well? If somebody has, I suppose, maybe a lifestyle change like that, where they're suddenly doing strength training, which is something that obviously we're excited about and it's great for the bones and great for muscles and something I do myself. But do you notice that that's something when people are trying to eat more that
I think if you make big changes to your diet, your gut can get a bit of a shock.
Okay.
But your microbes can.
Yes. Of course.
And I think if you go heavy with one nutrient but lose the balance, that can impact your gut as well.
Sure.
So maybe not that it's, don't get, hooked on numbers of protein. I just don't think it's there. But I think the distribution of protein throughout your day is the bit that people maybe fall down on. You kind of spread your protein out throughout the day.
Sure.
But you need balance. You need lots of different fibre foods alongside your protein.
Okay.
And that will still nourish the bugs, plus get the extra protein. And hey ho, you should be okay. Protein powder is another thing. Usually they're highly processed. Can be more difficult to digest. So I'd probably look into that as well.
Okay.
You get a lot of protein from food,
Yes, absolutely. Yeah.
Really good quality protein from real foods.
Yeah.
I'd definitely start there as well rather than whacking in supplements.
Okay.
Sometimes people need supplements. That's okay. I get it. Let's usually start from the bottom and build up.
Yes.
And see how your gut responds. But if you do make a massive change overnight, your gut will just be like, I don't know what you're doing to me. What's going on here? Let's have a little tantrum and have more bloating because I'm confused.
Yes, absolutely. And I suppose there's lifestyle changes, and then say for women, for example, there's menstrual changes throughout the month. Is that something that you help women with kind of? Yeah,
we can't really control the hormones. Nope. That will be with your gynae.
Yes, of course.
But you can definitely have good habits around it. So the basics will always be there. Yeah. That's your foundation.
The whole foods.
And then if you get more symptoms around that, then you maybe have a plan.
Yes.
So you can treat it. So if it was constipation, which can happen a lot of the time in the run-up,
Yes.
then you'd know what foods can help with constipation.
Yeah.
Psyllium husks is a fibre supplement, a very unique fibre supplement that works like a real treat. I use it in very small doses.
Okay.
And it can be really helpful for helping the bowel, just keeping moving, keeping regular, feel that it's complete when it empties, and that can go a long way at managing the symptoms.
Okay, so really kind of natural. So
Yeah. And then bloating, you may have other foods that help with that.
Okay.
Medications aren't great, but you can use things like peppermint oil capsules are good for bloating.
Yes.
If it was loose stools, actually, people get confused with this as well, but that soluble fibre works with loose stools and it works with hard stools.
Okay.
So it brings you back into centre.
Sure.
So that can be helpful. But I think an individual assessment sort of sheds light on what you can do, but there are things you can do.
Okay.
Yeah.
Okay. And I think you mentioned bloating there. That comes up a huge amount in the pharmacy, that people say, I'm just so bloated all the time. And like that, they take the peppermint oil capsules. And I often would refer them, if they've been taking them for a while and they're still experiencing bloating. Is bloating, I suppose, is it just something that's normal? Or if we are feeling bloated all the time, is it something that would that be a reason to go to the doctor and have that assessment, or go to?
I would definitely look.
Yeah,
for sure, because it might be gut, it might be hormonal.
Yes.
A small bit of bloating is normal. If you go out for pizza and beer, you're likely to be bloated, right? Okay, that's okay. After Christmas dinner, you're likely to be bloated. That's not pathological.
Yes.
But if it's continuous and it feels, the discomfort, and you feel like there's just so much air blown up inside you,
okay,
that can be investigated. Number one, I'd look at the bowels, because sometimes people are bloated and they're constipated, but they don't think they're constipated.
Yes.
So you may be passing a bowel motion every day, but it may be hard, but it may not feel complete.
Okay.
Incomplete evacuations, that feeling that we don't pass the stool fully, is a huge trigger.
Okay.
Or driver of gut symptoms from the assessments that I would do in my clinic. So I'd, number one, look at that.
Yes.
Then I would look at the basics again. Are you eating regular meals? Are you hydrated?
Yes.
Are you taking your time eating? And then have a medical assessment to further look into it. But I would, if you have ongoing gut symptoms and they're impacting your life, it's worth looking at why that is happening to you, because I fully believe that there is a way to manage it and get you symptom free again.
Okay, good. And I suppose with the title of your book being Why You Can't Go, I guess that, you've explored all of those reasons why people can't go. And one that comes to mind as well is even just like, I suppose maybe stigma, like we don't talk about constipation or going to the toilet.
Why would you want to?
Yeah, I suppose there's that element, and then maybe people being in a workplace where they don't feel maybe comfortable that they can't go, that kind of thing as well impacts. So I guess you explore environment and all of those kind of factors. Yeah.
I think it's, nobody has to talk about their bowel motions, but we all do it.
Yeah.
It should universally connect us, because we all have to do it, hopefully most days.
Yes.
And should feel good. And if it's not, then, doctors and dietitians are so used to talking about poo. It's not a thing. We've heard it all. But it's okay to find a safe space to talk about it. It's better to talk about it than not. But you kind of have that fear of using the toilet outside if you're constipated. But you can train your bowel to hold, and then it doesn't want to go. So it can worsen constipation. But you can get stage fright of wanting to use a toilet in mixed toilet settings and workplaces. So you might not go during the day, even if you have to go. And that's just a bad habit.
Yes.
There's ways around that.
Yeah.
And I think, you can work through that.
Yes. Okay.
It's all very relevant.
Yeah, no, it is, absolutely. Because if you have kind of normal gut, I suppose, function and you've a healthy gut and a healthy diet, but then when you need to go, you don't, or whatever, that's a problem. And you could start, giving yourself gut problems or constipation by just denying yourself denying yourself from listening to your body's cues naturally. Yeah,
absolutely.
Yeah, I think that's a huge one as well that comes up. Even actually, I see it with just going to urinate, is a huge problem. Like I see it in teenagers and things like that, and parents that bring their children, and you can give yourself urinary tract infections and that kind of thing, that they feel like they can't go between classes and end up holding urine as well. So it's a huge thing. Just going to the toilet is just. And not being, I suppose, feeling like you have to restrict when or how?
Yeah, it's
you go?
behavioural. And
Yeah.
actually part of my sort of plan for constipation would have a morning routine.
Okay.
Because when you get up and you wake up, your bowel wakes up.
Yes.
And you want to kind of give it all the signals that you want it to move. So you
Yes.
sort of have hydration, you have a good, decent breakfast, you probably hopefully have a coffee. And then you try and have toilet protected time. You try and sit on the loo for 5 or 10 minutes and relax.
Okay.
You can even use that breathing activity when you're sitting on the loo.
Yes.
Bizarrely enough, but it helps your body relax. And when your body is relaxed, your gut is relaxed.
Yes.
So it gives your brain the signal that, everything's okay.
Okay.
You're not interrupted. You're chill.
Yeah.
It's time to have a bowel motion. Go and do your business.
Yeah.
But
Okay.
typically, what are our morning routines like in Ireland? We get up, we get everybody together, we run out the door, we forget a bag, we're racing with traffic
Yes.
to log on, we've got a meeting, we forget.
Yeah.
We should have sat in the toilet. 5 minutes.
Yes.
But actually, over and above eating, that can be the one thing that's hampering people's ability to have a normal bowel motion.
Yeah, just not even giving yourself the time.
Yeah, the time.
Yeah.
Yeah.
That's a good one. And is there a reverse problem with people staying on the toilet too long with like phone scrolling and things like that? Is that something that
I think
comes
that
up?
has come up about hemorrhoids.
I've seen it about hemorrhoids and something.
Yeah, so 10 minutes max, guys.
Yeah, max. Yeah, don't overdo it. That's so helpful. And I suppose in terms of like we've talked about lots of kind of practical kind of tools that we can use to start feeling more in control of our gut. For anyone who kind of feels like their gut controls their life right now, and I suppose this might be a good kind of point for us to wrap on, like what would you want them to know about recovery or improvement from your perspective?
I want you to have hope that you can actually manage IBS, because once you understand it and once you understand your gut, and it's looking at the consistency, there's no perfect diet, and routine and consistency, and hopefully working with a healthcare professional to really understand what's going on, you can manage this thing. You do not have to stay living with these symptoms for life.
Okay.
Yeah.
That's very empowering, Lorraine. Thank you so much. And I think if it's something that you've been putting off, for a long time, maybe this 2026 is the year that you do finally address it and get the right help that you need. I'm sure you'll save yourself lots of heartache by working with, somebody who really, really knows their stuff like Lorraine. And I can only recommend your books as well as a great place to start and to borrow your information for anybody who isn't maybe in the Dublin area that we're in right now. So thank you so much for joining us, Lorraine. It's so helpful.
It's
and
great.
Make sure that you do check out all of Lorraine's information and her social media in the show notes below.
Thank you.
That's it for today's episode of The Wellness Script. If you enjoyed it, make sure to hit subscribe and review with 5 stars. It really helps us to grow and keep these evidence-based conversations coming with top experts to help you on your health and wellness journey. You can follow us at Wellness Script Pod on socials for more. And a huge thank you to our sponsor, Sona Vitamins, Ireland's longest established nutritional supplement producer. Catch you next Wednesday with a brand new episode, Your Prescription for Better Living.